The work of a husband and wife team from the Bay Area is raising hopes for some of the youngest victims of disease in the developing world. Their nonprofit is centered in the West African nation of Mali, and according to a newly published study, their strategy could have a revolutionary effect on childhood survival.
When we first met Doctors Ari Johnson and Jessica Beckerman, they were splitting time, treating patients at Zuckerberg San Francisco General Hospital and half a world away in the West African nation of Mali. But their ultimate goal was training volunteers to act as a lightning-fast strike team.
Time is the key here. So speed, we think, is the most important element.
He says some of the most common killers of children in Mali are diseases that are completely curable. So their nonprofit, Muso, began organizing local outreach teams that could canvass villages, literally knocking on doors looking for sick children.
Creating rapid referral systems at a community level.
They armed these teams with fast-acting blood tests and drugs to treat malaria, pneumonia, and diarrhea.
Because if you can reach patients fast, there's no reason that patients should be dying of malaria or diarrheal disease or pneumonia.
And now, less than a decade since they launched this outreach model, a newly published study is pointing to its promise. In the neighborhoods around Mali's capital city, deaths of children under the age of 5 have plummeted from 1 in 7 to now 1 in 142.
Lower than any other country has documented in sub-Saharan Africa.
But Dr. Johnson believes the big takeaway here is the average cost, about $8 a year per patient.
I think the most important lesson is that the global child mortality crisis, which kills more than 5 million children every year, this is solvable. Even in some of the most challenging settings, we have everything that we need to end this crisis.
It's remarkable work they're doing. And one more note, the study did not include comparisons to a control group not receiving the same care, but the results are impressive enough that Muso is now hoping to conduct a large randomized study of 100,000 patients or even more.